So Heather, in a recent blog post, you wrote about how physicians are always rushed and how technology could help them not have that rushed feeling and that urgency.
Sure. Well, usually when a physician goes into the room, they're trying to log into the system, they're trying to find the patient, they're trying to pull up the problem list, and so much of that is, I think, them feeling like they're on the hot seat as they're just trying to assess what's going on with that patient at that point in time and navigate through the system at the same time and realize that, oh, wait, you might have had labs and I'm not finding the labs, and where are those labs, and you had a consult with another specialist, and where is that? And a lot of that burden can be actually managed by proper planning ahead of the visit. And so if you have other care team members who, before a patient presents, you're doing morning huddles and you're looking at who's coming in for the day. Do we have all their labs? Do we have the specialist visits in? Oh, there are open gaps in care. Have we addressed those? Is there any, do they need a prescription refill? Why don't we make sure that we get that ready ahead of time so it's all ready for the physician? And some of that prep is already done, so when the physician enters the office with the patient, they can begin with a dialogue instead of a feeling of panic that they are on the hot seat and cannot find information that they ultimately are accountable for. And so it just changes the tone, the tenor of the appointment altogether when they can present in that way. They don't need to be hunting down all of this information. Other care team, it can be a medical assistant, doesn't even have to be a nurse, can actually be helping in the preparation. And those practices that perform morning huddles end up having the better outcomes, higher satisfaction. It's a central tenet to medical homes is actually practicing that. And in the past, when I've actually looked at health outcomes across sites that actually did morning huddles versus others, there was just much higher outcomes and much higher degree of coordination even among the physicians in the practice altogether.
Your point about the morning huddles just resonates with me because I completely agree with you on that, right? So I always say that the funny thing about clinical workflow in general is if it doesn't work and if it doesn't flow, then that's not workflow, right? And when you look at morning huddles and the specifics of how you have residents or you have fellow trainees, maybe even aiding in the work that you're doing, or you have scribes or you have PAs that are helping you as well. And you go down to the specifics of how that's actually working, how those huddles are actually contributing to the overall efficiency of that workflow. And then you marry that with the advent of technological capabilities. And you suddenly realize that, look, all of that scut work that used to be done can also be done by technology. That technology like AI, for example, could mine for relevant bits of information that when contextually represented and presented to you at the point of decision making could actually make a tremendous amount of difference in reducing burnout for the physicians.
This idea that your physician is going to see you for 8 to 10 minutes once in 6 months, possibly twice if you're lucky, is ridiculous, right? And the opportunity we have with technology is to extend that visit, pre, during, post, whatever the technology might be. Janae, do you have any thoughts on that, particularly as a young newborn in the house?
I never want to see my doctor. Just kidding. Yeah, I really think there are so many opportunities for technology to make things easy. And actually, I have a physician that uses technology that way, and I sought them out. I actually asked the mom group, for real. I was like, hey, who is good at these things? And then I sat down with them and talked to them about it. Because ideally, they'll be able to get that picture really quickly, but I don't have to spend tons of my time, and they don't have to waste their time. I don't like wasting time.
And it's ultimately a win-win, right? Because now you have a physician who's also satisfied with their job, has better tools, has better assets.